Welcome to the Postmodern lecture. This one is a fun one because there's several different approaches combined in here that we'll talk about. And the first one is going to be solution-focused behavioral or solution-focused brief therapy. So I really like this approach, one, because it's more positive, and so it focuses on what's working. So think all the way back to Freud and some of the theorists that we saw early on. It was all about what wasn't working, what was going wrong, eventually what type of diagnosis does this person have, as opposed to this approach is way more, again, focused on the positive, focus on what is going well, what are we doing that's going well. And it's this shift which is kind of goes against our wiring, right? Because our brains, think back to caveman days is usually the example that's given. You would need to remember, if I walk along this path, maybe this is where a tiger jumped out of this last time. Maybe we need to avoid, running into a tiger. Or, we tried to eat these berries and someone got poisoned and their stomach really hurt. We need to remember to, not eat those berries. So our brains are naturally wired to focus on those bad things from a survival approach. But overly focusing on negative things, of course, isn't healthy. And we talked about that in the CBT lecture in terms of, well, these extremes, these all or nothings aren't helpful. How do we kind of find that middle of the road? Something you might say to a client about this is, tell me about a time when you felt a little bit better or when things were going your way, to get a sense of when was a time when things were going well? What were they doing differently? This is very problem solving. So again, it's focusing on what's going well, and if there are problems, how do we fix those or how do we solve them? But it's much briefer oftentimes than other therapies. So here you might see a client for just a couple sessions because, again, whatever they have going on oftentimes isn't super in depth or isn't something that you're going to need like 20 to 30 sessions for. This approach, again, takes a slightly different perspective from the original theorists that we saw, in the sense that the client is the therapist, the client is the expert. And so, again, I think I might have shared an example with you guys. If not, I'll typically say something like, you as the client are the expert of your lived experience, right? I haven't lived in your shoes. I haven't walked in your shoes. Even though we've been talking for an hour or I did an intake with you, there's still so much that I don't know about you. And usually I'll give some example like, I don't know what your husband's name is, or I don't know what your dog's name is. And they're like, yeah, okay, all right. And so that just highlights and puts them in a position of power to say, hey, I'm not, as a doctor, I'm not here to fix you, but I'm here to help you fix yourself or solve your own problems. And let's work as a team. But you're the one who's going to be doing the work here, and you are an expert of your own experience. Positive psychology. So I won't go into depth here too much, just kind of a quick brief overview. It's defined as the field of positive psychology being the subjective level at which we're focusing on things like our own well-being, our contentment, our satisfaction. And a lot of times these things are really hard to like quantify. Like, how do you know that you have well-being? Like, on a scale of 1 to 10, how do you know that you have well-being, or how do you know that you have hope and optimism? It's not something that you can really put a number to. It's more subjective. This focuses or includes paying attention to flow and happiness. At the individual level, it's about positive individual traits, so the capacity for love, for enjoying what you do, enjoying hobbies, maybe even enjoying the work that you do at your job. It includes courage, interpersonal skills, perseverance, forgiveness. So there's a lot of things that wrap up into positive psychology. In terms of the Perma model, which I like because it adds a nice structure. So you're focusing on factors or strategies that increase positive emotion, or just pay attention to emotion in general, but again, not necessarily focusing on one or the other. So what I'll tell individuals in terms of positive emotion, again, we're not trying to do these extremes. So I'm not trying to have you be happy all the time every day, but it's how do we increase a little bit, or how do we kind of get you more in that middle of the road as opposed to feeling depressed all day, every day. Engagement. So this is focusing on, having that person become more engaged in their life in terms of if you're not doing things that you used to do, hobbies, going to the gym, how do we get you more engaged with those things? Relationships, how do we focus on positive relationships and build up those positive relationships as opposed to, maintaining unhealthy relationships? Meaning, what brings meaning to this person's life? Is that from their work? Is that from their hobbies? And then accomplishments. It's really important, I think, to pay attention to not only what our goals are, but often also achieving those goals. And again, it's going back to that CBT side of things. It's not disqualifying it like, oh, yeah, I graduated college, but it's not that big of a deal. Now I need to focus on getting a career. Like, no, that is a big deal. Let's highlight that. Let's celebrate that accomplishment. So that's just a quick overview of the Perma model. And then again, of course, positive psychology is going to focus more on that optimism side of things, focus on strengths and how do we use our strengths. We've talked about that in a previous lecture. Incorporating gratitude, incorporating a healthy mindset, those types of factors are all going to be present in positive psychology. So I thought I would just briefly touch on fixed mindset versus growth mindset, since we talked about that just a tiny bit in terms of that optimism and that mindset in the previous slide. So if you're not familiar, Carol Dweck wrote a book and developed this idea of growth mindset versus fixed mindset. And essentially growth mindset is the ability to, you see a challenge or you experience a challenge, but it doesn't cripple you or it doesn't, make you just kind of like curl up in a corner or something, but more you have that mindset of, okay, this is a challenge. How do I take this? How do I learn from this? How do I overcome this challenge? How do I grow from this? And so that's the growth mindset. And so that's something that I have worked with therapy clients to incorporate and help them shift that perspective. Again, kind of going back to some of the things that we talked about with CBT, cognitive restructuring, that kind of stuff, to shift from this fixed mindset of, like avoiding challenges, oh, that's too hard for me. I can't do it. Oh, I'm never going to succeed at that, to no, how do we have this more growth mindset of, okay, it's a challenge, but I know I can overcome it. I have the skills or tools, or I know someone who has the skills and tools that I can say, hey, will you please help me with this? And so it can be really helpful to know about this approach and then be thinking about it or be discussing it with therapy clients. The exception question. So this explores a time when the problem did not exist or was not as intense. So something that I might say to a client is, what did your life look like prior to the situation or problem? What strengths or coping strategies were you using at the time? What were you doing differently? And what you'll notice is oftentimes, not always, but oftentimes the client has stopped doing something. For example, stopped going to the gym, or, oh yeah, I was eating healthier during that time, or, oh, I was sleeping better. I was either going to sleep earlier or I had better quality sleep. Or, oh, during that time when things were better, I was spending more time with friends and family. I was, engaging in whatever hobbies, etc. And so that can help the client explore and pay attention to, all right, well, this problem that you're saying that's going on or that's occurring, it hasn't been occurring for forever. So tell me about what are exceptions when this doesn't occur, or even, okay, so you're experiencing this problem. What are exceptions to when it doesn't occur during the week or during the day or during the month? And so helping not only you as the therapist, but also the client, take a pause and think and pay attention to what are those exceptions. Because sometimes we're so busy in our day-to-day that we don't really stop and think about, like, oh, well, actually, you know what? I do feel better when I go to the gym. I'm just not very consistent with it. And now that we're talking about it, actually, maybe I would feel better if I did consistently go to the gym and XYZ, and then, the conversation goes from there. So again, it can be just a helpful tool to help the client slow down and think about what's going on and what are those exceptions. The miracle question. So this can be fun to ask a client as well. And essentially, it's, if a miracle happened and the problem you have was solved overnight, how would you know it was solved and what would be different? And sometimes clients will kind of get wrapped up in this, like, well, what do you mean it's solved? Like, do I wake up first thing in the morning and it's gone? Or do I, do I notice that it's not a problem at noon when I'm eating lunch, or like, okay, now let's not get into the weeds. The emphasis here is, what is the client going to be doing differently? And so this is a time for the client to kind of allow themselves to dream and think about the changes that they want to see or that they want to start to experience, and what are the factors or actions that they would be doing differently to help make that happen. The scaling question. So, have you ever said something all or nothing? I know we talked about this during the CBT lecture. So, things that clients have said: I can never be happy. I'm always a mess. My life is always a mess. I won't ever reach my goals. I always want things to go my way. Therapy will never be helpful. So, it's this all or nothing, these kind of extremes. And so asking someone to scale something can add more shades of gray or take away that all or nothing. And it helps us increase awareness, and it helps the client observe their thinking, which we talked about in CBT. So several examples of this might be, on a scale of 1 to 10, how would you rate your depression symptoms, with 10 being, I'll usually say something like with 10 being the worst, or with 10 being so bad that you're, like at the hospital, or you're not getting out of bed every day, something like that, so that the client knows that 1 is more on the good end in this way, and 10 is more on the unhealthy end. You can, of course, flip that. So you could say, on a scale of 1 to 10, with 1 being the worst and 10 being the best. It's just how I've always described it. So with 10 being the worst. Okay. The client says, well, it's a 7. Okay. So you said it's a 7. What would make it a 6, right? So essentially, what would make it a little bit better? What would bring that number down? What makes it better or worse? What are the things that you're doing that would make it a 6 versus a 7? And so again, helping the client explore, what are they doing? What are they not doing? And increasing their awareness around that. And sometimes it can be really interesting and fun to have this conversation with clients, because as they start talking about it, it's almost like they kind of back themselves down, like, oh, well, now that I'm talking about it, really it's not a 7, it's actually more of maybe like a 5. Like, it's really not as bad as I initially thought it was. And so just them talking about it and having the conversation with you and kind of thinking things through, they're like, oh, actually maybe it's not as bad as I thought it was. Or it could be that, well, it's a 7, and if I just tweaked this one thing or fixed this one thing, like I said in a previous slide, of like, well, if I, started going to the gym consistently, so sometimes it's not like these earth-shattering massive changes that needs to happen. It's like these little small tweaks that, if I just did this one thing or that thing, I would be, in terms of depression symptoms, I would move to a 6 from a 7 to a 6. And then, you just kind of keep going from there. Okay, well, maybe in a week or later on that session, you say, okay, well, now you're saying you're at a 6, or now you're saying you're at a 5. What would move it from a 5 down to a 4? And something else, that another way that you can ask this or approach this is, okay, so you're saying that you're at a 7 right now. What would it be like to be at a 2 or a 3? Or what would it be like to be at a 1 or a 2? In terms of whatever it is, you could apply this to pretty much anything, like depression symptoms, anxiety symptoms, sleep issues, whatever it is. And so again, it's allowing the client to kind of dream and think about, like, what would it be like if this were only, a 2, if my depression symptoms were maybe a 2 out of 10, like, well, maybe I would be experiencing this symptom and this symptom, but I wouldn't be experiencing this and this and this and this and this. Or it might be, well, maybe it wouldn't feel as severe when I am experiencing it, so if I experience it, would be like, I'm feeling kind of sad today, as opposed to like, I'm feeling so sad today. And so again, it's just increasing the awareness of what is that intensity, and what are the actual symptoms that are occurring. And so increasing awareness around those can be really helpful, because again, a lot of times once you start to talk about it, you're like, oh, actually, really, it's not that bad. Narrative therapy is another approach that's within this postmodern therapy approach. So narrative therapy, I like this. I like incorporating this within therapy sessions and with clients, because the stories that we tell ourselves are so prevalent. And we talked about this during the CBT lecture, where, I'd have to look it up. I don't know the exact number of thoughts, but we have like 70, 80,000 thoughts a day. Maybe it's higher than that. We have a lot of thoughts every day. And a lot of times those stories or those things that we're thinking are not only unhelpful, but they're stories that are maybe almost holding us back or keeping us kind of locked in this cage, if you will. Or for our therapy clients, it's the thoughts or stories that are almost keeping them stuck where they're at. So how do we avoid getting stuck in that story? So getting a better understanding of what the client's experiences are, and identifying preferred directions, and just sometimes kind of listening to them and paying attention to what are the stories that they're telling themselves, and that comes out through what they're saying to you, how they're telling a story, how they're describing what's happening in a story. So if they're saying something, are they describing themselves as the victim in the story? Are they describing themselves as the hero? What are the stories that, what are their thoughts, and what are the stories that they're telling themselves within that? And so it can be really helpful to have the client explore this a little bit more, which is what you guys are going to do as part of your discussion post this week. So there's a couple different exercises. Again, we all live by the stories that we tell ourselves and that others tell about us as well. So an example of that would be, if Anne goes to work and Anne is someone who's really nice at work, her coworkers might tell a story about her that, Anne is really nice. I enjoy working with her. I would want to work with her again. If she decides she wants to move to a different company and she asks for a reference from her boss would tell the story that, we really like working with Anne. We're sorry to see her go, but we recognize that it's a step up for her, or this would be a great promotion or a great opportunity. But yeah, I would totally recommend her. That's the story that other people at Anne's work are telling about her. So we all not only tell stories about ourselves, but we also tell stories about other people. From the textbook, when stories are changed, not only is the person telling the story changed, but the therapist who's privileged enough to be a part of that unfolding or that process is also changed. So again, I've talked about it can be really cool to experience this and see this happen in therapy or witness it happening in therapy. So there's a worksheet that is uploaded to Canvas. Respond to the worksheet prompts. The worksheet explores different things like past, present, and future in terms of the story that you're telling yourself. And it can be beneficial to spend some time focusing on this or paying attention to it, because again, it can contribute to a greater sense of meaning, purpose, happiness. And so this is an exercise that I would use as maybe a homework practice for a client if we were incorporating a narrative therapy approach. Another alternative is, so one aspect of narrative therapy is talking about deconstructing a problem, or deconstructing a problem-saturated story and reauthoring or enhancing the story in some way. So essentially, it's helping your client write a different storyline. So going back to the previous slide where I said, is the client telling the story in a way where they're the victim? How do you help the client rewrite that story or write a different storyline where they're not the victim, where they're maybe either just present or maybe where they're helpful, but again, maybe not that extreme, right? So they don't go from being the victim to being the hero, but again, where's that kind of middle of the road? So the past can be changed by creating new stories in the present. So for example, I talked about if you're being maybe a lot of therapy clients have experienced some type of trauma in the past, and so how do we help them change that storyline? And that's one of the big aspects of trauma-focused therapies, which we won't get into for this class. So say you've got a client who's had some kind of very negative experience in the past. How do you help them rewrite that in their present so that they don't continue to be either re-traumatized by things in their present, or they don't continue to live their life based on whatever they experienced in the past, right? So essentially coming up with a better story or narrative, better coping strategies, etc. So option one is to step back and ask why. So writing about a difficult life event or experience, do not simply recount it though, but reconstruct it. So write the analysis of what you see when you watch the event replay in your mind, why it happened, why you felt or reacted that way, and what you would do differently. Whereas future framing, or the best possible self-exercise, It's particularly helpful when feeling lost or aimless. So imagine where you would ideally be at some place in the future. So maybe 3 years from now, 5 years from now, 10, maybe even 15 years from now. Although for a lot of people, going out 15 years can be really hard to imagine or think, where would I be then? And from that place, then write the story of essentially how you got there. What were all of the things, all of the steps that you did to make that happen? Here is your discussion question or prompt. I already talked about essentially do one of the exercises and then answer the second prompt there, which is identify something from the textbook that wasn't covered in the lecture. And that's all I've got for you guys this week. So here are my references. You guys have a wonderful week. Let me know if you have any questions, comments, or concerns. Thank you.